If you don't keep an eye on your blood pressure, it could cause serious problems like heart disease and stroke. A good way to protect yourself from high blood pressure is by watching what you eat. Choosing foods that are good for your blood pressure can help keep it at a healthy level without the possible side effects of medications. Besides certain foods, there are also some drinks that might be beneficial in lowering your blood pressure. On this episode, we will explore 6 types of drinks that could potentially help bring down your blood pressure. Let's begin with understanding what blood pressure is. High blood pressure happens when the force of blood against your artery walls is too high. This extra strain can make your heart and blood vessels work harder, potentially harming your heart muscle in the long run. Moreover, it may cause small tears in your artery walls, leading to the buildup of fatty plaque. This condition typically develops gradually and can be influenced by factors such as an unhealthy diet, lack of exercise, and certain health issues like diabetes and obesity. It's crucial to address high blood pressure because it raises the risk of various health problems, including heart disease, stroke, and kidney failure. Treatment usually involves a mix of medications to relax or widen blood vessels, along with making changes to your diet and lifestyle. Let's now explore the drinks. Drink number 1, beet juice. These vibrant and low-calorie vegetables not only come with a variety of vitamins, minerals, and plant compounds that promote health, but they might also help reduce your blood pressure. A study conducted in 2016 discovered that both raw and cooked beet juice had a positive impact on blood pressure, with raw beet juice showing a more significant effect. Beets are packed with dietary nitrates, which are known to lower blood pressure. A review in 2017 revealed that the benefits of beets on blood pressure extend beyond the effects of nitrates alone. In simpler terms, there are likely other heart-friendly compounds in beets contributing to these positive effects. Drink number 2, tomato juice. Recent research indicates that having a daily glass of tomato juice can be good for your heart. In a 2019 study, Japanese scientists looked into how drinking about 1 cup of tomato juice every day affected people with heart disease risk factors. The findings showed that tomato juice had positive effects on both systolic and diastolic blood pressure, as well as LDL cholesterol levels. Other studies have also supported these results, especially in individuals with stage 1 hypertension and pregnant women. To keep things healthy, opt for unsalted tomato juice to avoid unnecessary sodium, which could have a negative impact on your blood pressure. Drink number 3, pomegranate juice. Pomegranates are not just tasty, they are packed with good stuff like folate and vitamin C. What's even cooler is that they have strong anti-inflammatory powers, so it's no surprise that drinking pomegranate juice can be good for your heart. In 2017, researchers looked at 8 different studies where people drank pomegranate juice. They found that it can actually help lower both types of blood pressure. The top number, systolic blood pressure, and the bottom number, diastolic blood pressure. Here's the cool part. It doesn't matter how long you have been sipping on pomegranate juice or how much you drink, it still helps with the top number of your blood pressure. If you are thinking of adding pomegranate juice to your diet, go for the 100% juice with no extra sugar. That way, you are getting all the good stuff without any of the not so good stuff. Drink number 4, berry juice. Berries, especially blueberries, are like little antioxidant powerhouses similar to pomegranates. According to a study from 2020, drinking cranberry or cherry juice might help improve your blood pressure. In 2016, another study published in Nature found that eating berries can lower both systolic blood pressure and LDL cholesterol. Both studies suggest that berries could be good for your heart, but more research is needed to fully understand their role in preventing and managing heart disease. If you choose to buy berry juice from the store, check the label to make sure it does not have any added sugar. Drink number 5, skim milk. Choosing low-fat dairy products like skim milk and yogurt is an important part of a diet called dietary approaches to stop hypertension, which helps prevent and manage high blood pressure. A study from 2018 involving 2,694 adults found that having more low-fat milk was linked to lower systolic and diastolic blood pressure. However, the researchers couldn't pinpoint which part of dairy was responsible for this, suggesting that phosphorus and calcium might be involved. Health experts usually recommend having 2 to 3 servings of low-fat dairy per day. You can have a glass of milk with your meals, mix it into your cereal or a smoothie, or even add steamed skim milk to your coffee. For a more sustainable diet, aim for around 250 grams of dairy per day, not exceeding 500 grams. This is roughly equivalent to an 8-ounce cup of milk or yogurt, or about an ounce of hard cheese. And now the final drink. Drink number 6, tea. When talking about blood pressure, not all teas have the same impact. In a study from 2020 that looked at various controlled trials, researchers compared how black and green tea affect blood pressure. They found that regularly drinking both types of tea can help lower both systolic and diastolic blood pressure over the long term. However, the decrease in blood pressure was more noticeable for those who consumed green tea. Now, let's look at the effect of coffee and alcohol on our blood pressure. Caffeine can temporarily raise blood pressure, but recent research suggests this effect might be insignificant. While caution is advised, moderate coffee consumption seems generally safe and may even have benefits. The consensus is, if you are not already a coffee drinker, now may not be the best time to start. Consuming alcohol can make it harder for blood pressure treatments to work effectively. People who drink alcohol may forget to take their medications as directed, and alcohol itself can also reduce the effectiveness of the medications. Let's now look at the drinks that should be avoided with high blood pressure. Certain drinks can either help lower or increase blood pressure. If you are dealing with high blood pressure, consider limiting or avoiding the following. Number 1, soda. Soft drinks are often high in added sugar, increasing the risk of heart disease and high blood pressure. Number 2, sweetened beverages. Drinks like iced tea can be packed with sugar, contributing to elevated blood pressure. Opt for unsweetened tea to minimize sugar intake. Number 3, energy drinks. These beverages, rich in caffeine and sugar, have been linked to increased systolic and diastolic blood pressure levels. Number 4, alcohol. Alcohol consumption may be associated with higher blood pressure. To maintain a healthy heart and lower your blood pressure, follow these steps. Number 1, reduce sodium intake. Cut down on salty snacks and processed foods, aiming for no more than 1,500 milligrams of sodium per day, as recommended by the American Heart Association. Number 2, eat a balanced diet. Increase your intake of fruits, vegetables, and whole grains for essential nutrients and fiber to support healthy blood pressure levels. Number 3, exercise regular. Engage in at least 150 minutes per week of moderate intensity aerobic exercises, such as jogging or cycling, to strengthen your heart and maintain a moderate weight. Number 4, quit smoking. If you smoke, quitting can help lower your blood pressure. Smoking temporarily increases blood pressure, narrows arteries, and raises the risk of heart attack and stroke, especially with existing high blood pressure. So the bottom line is, besides maintaining a heart-healthy diet, certain beverages can aid in reducing blood pressure. Research suggests that various fruits and vegetable juices, skim milk, and green tea may contribute to blood pressure control. Consult with your doctor to discuss the most effective strategies for managing blood pressure and promoting heart health. Thank you for watching. Please like, comment, and subscribe. Watch more videos by clicking on the video here.